Newborns are born with several primitive reflexes that are essential for survival and development. The five primary reflexes we'll explore are the Moro reflex, rooting reflex, sucking reflex, palmar grasp reflex, and plantar grasp reflex. The Moro reflex, also known as the startle reflex, appears at birth and disappears by 3 to 6 months. When startled by a sudden noise or sensation, babies throw out their arms and legs and then pull them back in as if they're embracing themselves. The rooting reflex helps with feeding and is present at birth, disappearing around 4 months. When a baby's cheek is stroked, they turn their head toward the stimulus, which helps them find a food source. The sucking reflex is present at birth and coordinates with rooting for feeding, becoming voluntary around 4 months. When an object touches the roof of a baby's mouth, they begin sucking. This reflex is essential for feeding from a breast or bottle. The palmar grasp reflex causes babies to curl their fingers around objects placed in their palms and disappears around 5 to 6 months. This reflex is strong enough that some newborns can support their own weight when grasping an adult's fingers, though this shouldn't be tested. The plantar grasp reflex causes babies to curl their toes when the sole of their foot is stimulated and disappears around 9 to 12 months. This reflex is similar to the palmar grasp but involves the foot instead of the hand. It lasts longer than most other primitive reflexes. These primitive reflexes help healthcare providers assess neurological development. Abnormal persistence beyond the expected age may indicate developmental issues. Now let's examine additional important newborn reflexes, starting with the Babinski reflex. The Babinski reflex causes the toes to fan upward when the sole of the foot is stroked. This reflex should normally disappear by 12 to 24 months of age. Persistence of the Babinski reflex beyond this time frame may indicate potential neurological issues. The stepping or walking reflex is observed when newborns are held upright with their feet touching a surface. When held in this position, babies will appear to take steps, lifting one foot and then the other. This reflex typically disappears by 2 to 3 months of age. The asymmetric tonic neck reflex, or ATNR, is sometimes called the fencing position. When the baby's head is turned to one side, the arm and leg on that side extend outward. At the same time, the limbs on the opposite side of the body flex. This reflex normally disappears by 4 to 6 months of age. The gallant reflex is observed when the side of a baby's back is stroked. When stroked along one side of the spine, the baby's trunk will curve toward the stimulated side. Like the ATNR, this reflex also typically disappears by 4 to 6 months of age. These newborn reflexes have important clinical significance in infant development. Primitive reflexes naturally disappear as higher brain centers develop and begin to inhibit these automatic responses. When reflexes persist beyond their expected disappearance timeframes, this may signal potential issues. These issues can include developmental delays or broader neurological problems that require further evaluation. Regular assessment of these reflexes by pediatricians serves as an important screening tool for infant neurological development.